Hi, my name's Andy Bryce. I'm an EFT master practitioner, and I've been doing EFT for about 8 years, and along the way I've run into a number of consistencies and issues, and one of the things that I've noticed is EFT is really excellent when we use it for fears and phobias. And over the last couple of days we've been working with a number of clients, and we've recorded on camera the sessions. And I've been working with Dr. Dennis Bressack, who has been interviewing the clients before and after and observing the sessions. Dennis.
Yes.
Welcome.
Great to be here.
You know, it's great that when we talked a year ago, we were talking about how EFT would be great for dentists and their clients, because it's a pretty stressful environment, isn't it?
Yes, it is.
Yeah.
As a practicing dentist for 22 years, the one factor that always came up for me was how difficult it was for patients to come into the dental office to have dental treatment done, and how stressful it was for the office as well when those patients came in. Since I retired in 1994, it's always kind of been something that I thought, well, that would be nice to be able to have some kind of way of helping dentists with their patients to reduce their fears and phobias or anxieties about coming into the office, and also to help the dentists and their staff to reduce that stress. It's a very stressful environment at times.
Right. One of the things that you brought was the assessment ability.
Yes.
And could you talk about that? Because I'm not really up on that, so maybe you could explain it.
The form that I use is a very common form for to assess patients for their dental anxieties. It's broken up into 2 parts. The first part are 4 questions that determine the level of anxiety. And once the level is determined, then there is a series of procedures that are graded from either there's no problem with the procedure versus a very big problem with the procedure. What we did see was that all of the patients did have anxiety levels that were either high anxiety or that were in fear or phobia level. And the interesting thing was that on every patient, after having a session with Andy for about an hour, that level was decreased, and sometimes pretty dramatically, almost halved. And we will get into each patient individually, their levels of anxiety prior to and afterwards, and be more specific about each patient.
Great, thanks, Dennis. For me, the reason to make this available to the public is what Gary Craig has coined borrowing benefits. Borrowing benefits are benefits received by the individual whilst tapping and focusing on the issues of someone else. Borrowing benefits is something that we noticed through years of doing EFT with groups, that by tapping along with another, people were getting results and healing, even if the issue wasn't something that was identical to your issue. And I just loved that, because what would be more wonderful than to be able to release my issues and my problems without having to deal with them, and just by tapping along with someone else's experiences. And borrowing benefits has definitely been beneficial for me and many of my clients. And in this situation, you have the opportunity to tap along.